public advisors told the United Kingdom government to update its advice. It now says the symptoms to seem out for are a new, continuous cough, fever, loss of smell or taste. If you, or someone you reside with, has any of those symptoms, the recommendation is reside home to prevent the danger of giving coronavirus to others. The cough may be a new, continuous one, where you cough plenty for quite an hour, or have 3 or more coughing episodes in 24 hours. You've got a fever if your temperature is above 37.8 C. The U.S. Centers for Disease Control and Prevention's list of symptoms also includes chills, repeated shaking, muscle pain and pharyngitis. It takes 5 days on the average to begin showing the symptoms, but some people will get them much later. The Globe Health Organization says incubation lasts up to 14 days. When do people must head to hospital? The majority of people with coronavirus will recover after rest and pain relief, such as paracetamol. The main reason people need hospital treatment is difficulty breathing. Doctors may scan the lungs to figure out how badly they're affected and provide support, like oxygen or ventilation, if needed. However, people mustn't head to A&E if they're concerned. In the UK, the NHS 111 website will guide you through what to undertake to do. If you're so breathless that you simply just are unable to speak quite some words, you will be told to call 999, as this can be often a medical emergency. If you become so ill that you have got stopped doing all of your usual daily activities, then it'll advise reproof a nurse by dialing NHS 111. How do ventilators work? What is in treatment unit? Can I get tested? What happens in intensive care? Intensive care units are specialist wards for those that are very ill. Coronavirus patients will get oxygen support, which can involve employing a face mask or a tube within the nose. The most invasive way, for the foremost seriously ill patients, is ventilation, where air, with increased levels of oxygen, is pushed into the lungs via a tube within the mouth, nose or through a little cut within the throat. What should I do if I've got mild symptoms? Patients with mild symptoms should self-isolate reception for a minimum of 7 days. People are advised to not ring NHS 111 to report their symptoms unless they're worried. They ought to also not visit their GP, or A&E. Details for Scotland are to test NHS Inform, then ring your GP in office hours, or 111 out of hours. In Wales, call NHS 111, and in European nation, call your GP. If you have get contact with somebody who is also infected, you will be told to self-isolate. The World Health Organization has also issued advice for the general public. How do I protect myself? The best thing is regular and thorough hand washing, preferably with soap and water. Coronavirus spreads when an infected person coughs or sneezes small droplets, jam-choked with the virus, into the air. These are often breathed in, or cause an infection if you touch a surface they need landed on, then your eyes, nose or mouth. So, coughing and sneezing into tissues, not touching your face with unwashed hands, and avoiding close contact with infected people are important. People are most infectious once they have symptoms, but some may spread the virus even before they're sick. In England and Scotland, people are being advised to wear face masks in shops and on conveyance to assist prevent the spread of the virus.